Hello, everyone. We'll be getting started shortly. We want to start letting people get a chance to get in. Thanks for attending. All right, everybody. Welcome to the Ohio Aging and Disability Transportation Forum Series number 2. Today, our topic will be mobility managers, the link between community partners and transportation providers. Today's forum has been brought to you by, of course, Ohio Developmental Disability Council. They are so great, and they have been a great sponsor for us for the past couple of years. So we really want to thank them for being able to have this opportunity to put these forums together. It has also been brought to you by Services for Independent Living, the Ohio Mid-Eastern Governments Association, Lorain County Mobility Management, and Coshocton County Mobility Management. My name is India Jones. I will be your webinar facilitator for today, and I am the Community Services Manager over at Services for Independent Living. Just a few housekeeping rules. Please, if you have any questions, feel free to put them in the questions box. After our panel of speakers, we will attempt to answer them towards the end. So while you're thinking of a question, please feel free to put it right in that question box, and we will get to it. We will have a recording on the Ohio Aging and Disability Transportation website, as well as SIL's website and our archived webinar selection. So please feel free to also contact me if you would like a copy of today's wonderful forum. After here, I will make sure that you get one. We will also have a satisfaction survey that always pops up at the end. If you have some time, please go ahead and take it. This is how we find out, what kind of other topics you guys are interested in when it comes to transportation. Now, I want to go ahead and open up the floor to our wonderful first forum speaker named Tracy Haynes. She is the mobility manager over in Coshocton County, and that's in Ohio, you guys, for those who have never been there like me. And so I just want to go ahead and thank you for agreeing to educate us today, and I'm going to hand everything over to you. And now you have the floor. Thank you, Tracy.
Thank you so much, India. Hi, everybody, and thank you so much for the opportunity to talk to you today about mobility management. It's a subject that's very near and dear to my heart. I began a career in transportation back in 2003. I started with coordinated transportation and come in and was just an administrative assistant. I started to do schedules, worked my way through the fiscal department of the agency, and ultimately in 2008, I became the transportation director. And I think it's that background that gives me a strong understanding of how to do my job as mobility manager. And I'll share a little bit of the overview of what that entails. So if you could go to the next slide. The Mobility Management Program is funded through ODOT, And it's either funded under the 5310 Specialized Transportation Program or the 5311 Rural Transit Program. We are under the umbrella of the Office of Transit, and Pamela Pate is new to our program, and she is our statewide mobility coordinator. And so we're so excited about the energy that Pamela is bringing to the program, and we look forward to supporting her and taking the program to the next level. Next slide, please. I've included a picture of the state of Ohio. It's been divided up into 10 regions. This picture is a little outdated. I did bring that to Pamela's attention, and she's working on getting that updated for us. And she's also hopefully going to be able to get the map to be interactive. So if you're out there and you're looking for a mobility manager, we're hoping eventually you can just click on your county or the person's name, and it will go straight to their website. At the time this was created, there were about, we're just under 40 mobility managers across the state, and we're serving 60 plus counties. So hopefully before too long, we'll have a mobility manager overseeing every county in the state. A lot of our counties differ greatly in size and with population. Coshocton County is very rural, a lot of back roads and sparsely populated areas. And then other areas like where Sharon Pearson is in Lorain County, they're more urban and there's a lot more going on up there. So where some of our counties differ greatly, we do have one thing in common, and that's the goal of mobility management. And our goal is to connect seniors, individuals with disabilities, and low-income residents with available transportation options. But we don't stop with just transportation. There's so much more that falls under the title of mobility manager. We work to fulfill mobility needs as a whole. Sometimes it's just getting a county resident out of their home into the sidewalk so that they can use public transportation or so that they can just be a pedestrian. Sometimes it's a little more complicated like that. Than that, and it's a person who needs a wheelchair ramp so that they can have independence of leaving their home and coming and going when they want. Other times, and this is very near and dear to my heart, it could be a multi-use path. We have been successful in getting a multi-use path in one area of our town where we've got a high population of low income and senior housing. And we've been able to give them a safer option. So where we talk about connecting residents with transportation options, it's mobility as a whole. Next slide, please. So what does a mobility manager do? And I'm just going to give a brief summary because I believe another panelist was going to give you a more in-depth look at this later in our presentation. So we assist individuals with accessing all community transportation options. And as I stated before, this differs county to county. In Coshocton County, we have one public transit agency, and we have 2 taxi services that we're able to work with. And, you know, in your more urban areas, you've got multiple providers, multiple taxi services, paratransit, different things. So they are on a much higher level of communicating with providers than we are in our smaller rural areas. We increase awareness of community transportation needs, and we do this in many different ways. COVID has increased our public outreach through social media, through radio ads, newspaper ads, and just by communicating on social media as a whole. Before that, we were able to go out into the public, and we were kind of shut down for quite a long time. So we became more crafty with our outreach through social media, and it's proven to be very beneficial. And we were able to keep avenues open for those who were at home now instead of being out in the public. We also build sustainable and healthy communities by integrating transportation into planning and programs. We meet regularly with city officials, county officials, Chamber of Commerce, the veterans organizations, social services, our county board of DDs and their SSA departments, we work really hard to understand what the need is and what the unmet needs are. And then we build programs to meet those unmet needs and work towards sustainability. This is an ongoing thing. Most of our counties have what we call locally developed human resource transportation plans. And we do surveys and we do outreach and we meet with diverse groups of individuals to come up with those unmet needs. Then we develop strategies, or we develop goals and then strategies and action steps to help meet those goals and ultimately fulfill that unmet need. This is something that we do across the state. And while we're doing that, we look for longevity. If we create this program, what is it going to take to sustain it once our focus has moved on to something else? So our locally developed plans help us do that. And we work, like I said, our Port Authority is a huge part of what we do. Ohio Means Jobs and different people like that. So we've got a very, very diverse group of people working behind the scenes to help mobility managers do what they do. Next slide, please. Okay, mobility management program scope includes, but is not limited to, understanding and advocating. Mobility management begins and ends with a laser focus on transportation's many customer groups. We are always reaching out and trying to find those people who don't know about us, those people who are sitting at home because they don't know that public transportation exists. So it's important for us to understand who we are reaching out to, what our audience is. When we know what our audience is, it helps us structure a program to be able to assist them in the best way that we're able to do. So our scope also includes design and planning. A principal goal of mobility management is to design local and regional solutions customized to fit the community's needs, resources, and vision. And I mentioned regional solutions there. I'm going to talk about that a little more towards the end of my presentation, but regionalization is really important to the success of us on a local basis, but also across the state. Our scope also includes launch and sustain. When a mobility management practitioner, whether it's an individual or an agency, some of us like me, it's just me in the mobility management office in Coshocton County, where I have a great TAC board, Transportation Advisory Committee, that backs me and that I bounce things off of. It's just me here in the office. But other areas, we have mobility managers who oversee up to 6 different counties. And so that they have a staff under them that helps them to do this. We partner and design new services and extension or expansion of existing services. And there are several steps that we can take to ensure that a launch of a new or expansion to a business is successful and sustainable. But we do that as a large group, not individuals. We inform and connect. All mobility management activities point towards one goal, and that's connecting customers to the transportation options that best fit their needs. And that's really important. Everybody has a different set of needs. Sometimes we don't understand that need, or sometimes that need is not expressed until we receive referrals or until we do surveys and we come across a survey where that need is expressed, and then we work towards meeting that. And you can see in the picture there, I work very, very closely with Valerie Shaw, Transportation Director for Coordinated Transportation. A lot of what I do, I bounce off of her, and she continually helps meet needs for the individuals in Coshocton County. When I find a new need, I take it to her. We go back to the board and we say, how can we do this? How can we fulfill this need? So our transportation partners are key to what we do. And I rely heavily on her and her resources to sometimes fulfill the needs that come my way. Next slide, please. Is the next slide available?
Yes, I went to the next slide. You can't see it?
I don't see it on mine. I still see Valerie and I.
Okay. 1 second, everyone. Let me see what's going on. Yeah, we're on regional mobility management slide. Hold on 1 second. Okay.
And that's me.
Yeah, okay.
Do you want me to slide my slide over?
Yeah, I have it now. Okay.
Okay.
Let's see. There you go.
Okay, so I mentioned regionalization earlier, and this is something that scared me really bad when it was first introduced. Omega is the RTPO that oversees Region 9, which is where Coshocton County is located. And when the thought first came to me, or when it was first presented to me, that regionalization was a possibility, you know, there was that fear that if we become one in the region, am I going to have a job? Or is there still going to be a need for a mobility manager in each county? And, you know, we were hesitant to jump on board. But I can tell you this has probably been one of the best things that could have happened to mobility management, because I have the best team. I am surrounded by the best group of providers and mobility managers that anybody could possibly hope to be affiliated with. So Deb Hill is our transit planner, and she works at Omega, and she does a wonderful job of bringing us all together at the table. You know, when we do our surveys and we do our plan updates, we're just focusing on Coshocton County. But what we learned is that there are people who need to come to Coshocton County for employment or for medical care. There are people who live in Coshocton County that travel outside of our county to Tuscarawas or Muskingum County for employment and medical. So coordinating and partnering with these different agencies to understand what they can provide and bring to the table is so very important to our success. So as a region, we have begun to not only share responsibilities for the regional plan and updating that regional plan so that it includes all of our information and so that it's readily available for anybody who needs to see it, but we've started to streamline different things like our intake forms and our county surveys, so that when we're doing these surveys, we get uniform results across the board and we're not comparing apples to oranges based on the questions that were asked of our local residents. And this is very beneficial. We share successes, we share our struggles, and we brainstorm together to find solutions to those struggles and to the unmet needs that I spoke of. We share projects. Our superstar in Muskingum County, Nikki Silver, has initiated a regional online resource guide, and she has included the entire Region 9 in this. So we were able to submit information such as our transportation providers, our home health care workers, our social service agencies, information about veterans and different things. And she has created this online resource. Another thing that happened to us during COVID was our 211 had been disbanded. So Coshocton County had no great source to find resources to fulfill needs that were no longer being fulfilled because businesses had closed or were not doing public outreach and different things. So this online resource is so user-friendly. You just have to go onto the website. You can click Coshocton County. There's a drop down, and then you can pick the different categories that you need information on. And this is going to be an ongoing project. And we had discussed maybe quarterly, Nikki will put a request out for information on a specific group of providers, and we will gather that information, provide it to her, and she will update the regional resource guide. So we're super excited for this, and I have great ideas on how we can expand on this. And I'm hoping that this might be a model for regions across the state. We are a pilot region. We're one of two. Region 2 on the western side of our state is a second pilot region. So everything that we're doing is kind of live and learn, and we're tweaking things as we go. We're hoping to perfect it, and then, you know, working with ODOT and working with Omega, roll out what did work and what didn't work to the rest of the regions in Ohio, and as they're onboarded, share our successes and help them ease into this process. I'll give you a couple examples of how the coordination in our region's working. Tuscarawas County had called me one time with an elderly individual who needed to go to monthly appointments in Columbus, did not have the means to get there, was all on her own, and financially could not afford public transportation all the way to Columbus and back. And when the mobility manager in Tuscarawas County called me, I worked with Valerie at our transit agency. Tuscarawas County was able to get her to the Coshocton County line for the in-county or in-city public fare. We were actually able to provide transportation from the county line to Columbus and back for her appointment under Title IIIB funding that we received from the Area Agency on Aging. So she had very little out-of-pocket expense for this trip, and we were able to get her there. So that's one example of how we were able to provide transportation for an out-of-county resident to a different county at little cost, and that was a huge success for both Tusc County and for Coshocton County. And one of my most recent successes was a coordination with Nikki Silver in Muskingum County. Our county fair was last week, and we had a booth out there, and we were so excited to finally meet and greet the public face-to-face in person. And I had an elderly lady stop by, and she said, "You're just the person I need to see. I just moved in with my daughter. I am no longer able to drive, and my daughter works, and I feel like a burden on her, and I need transportation." So I got all excited thinking I was going to get to help her. And so as I start to talk to her, I realized she lives in Muskingum County. So I said, "I have just the person." So I got her information, and I also gave her the information for Nikki in Muskingum County. She called Nikki yesterday, and Nikki was able to get her connected with public transportation that fulfilled her needs. She needed to go to, I believe it was some kind of physical therapy 3 times a week. And Nikki connected her with the resources, and Nikki also went above and beyond and actually rode transportation with her. And as mobility managers, we can do travel training. So Nikki rode with her, so she understood where to get on the public transit, where to get off, and how to connect with it after her appointment was complete. She got a call from Nikki thanking her profusely. And this is what is so very important to me. She said, "I feel like I've gained my independence back." And a lot of what I do when I'm assisting a person is just that. I'm looking for a way to give them independence, to give them confidence in using public transportation, or, you know, just gaining them access to the outside world. I think that is just so very important to what we do. And it's above and beyond the actual transportation. It's that personal component in finding that need and giving that person access and independence again. So That is all I have for you today. I think I finished, oh, I'm 1 minute early. So without further ado, I would like to introduce to you Sharon Pearson. Sharon is our wonderful mobility manager at the north end of the state up in Lorain County, and I'm going to turn it over to her. Thank you all so much.
Thank you very much, Tracy. What a great presentation. So let's go on to the next slide. So as Tracy said, I am Sharon Pearson. I am the Lorain County Mobility Manager. And as she mentioned also, there are nearly 40 of us across the state of Ohio. About half the mobility managers are housed at a transit agency, and the other half are at a nonprofit organization. I happen to be housed at United Way of Greater Lorain County, and I have been a mobility manager since January of 2020. Although I'm fairly new, I have been involved with transportation since 2012. And I also happen to be the chair of the Ohio Mobility Managers Advocacy Committee as well. So next slide, please. So I'm going to get into a little bit more specific about what I have been doing here in Lorain County. Although we're a larger county than many of the other mobility managers, just the makeup and the geographic area and the struggles that we have here in Lorain County. So how rural is Lorain County? And I know that this is a topic that was of interest to a lot of people for this series. We are located right next to the Cleveland, Ohio area. We abut Cuyahoga County. We are considered a small urban and rural county for transportation. We have 312,000 residents in Lorain County, about 50,000 or about 16% drive to work. But unfortunately, we do not have that direct connection via transit or anything else to Cleveland. You really have to drive if you want to get into Cuyahoga County to access anything over there. And so that's where that regional aspect that Tracy was talking about really comes into play, and why it's really important to start looking at transportation networks from a regional standpoint. We are one of the most populous counties without a viable transit system. I believe we are the 9th largest county out of 88 in the state of Ohio. And as you can see from this map, anything that is not in yellow is considered rural. And those rural areas do not have any, there's no transit. And you'll see that in an upcoming map here about how little transit we do have and the challenges that we struggle with here in Lorain County. So the next slide, please. So last week, you heard about transportation surveys and the needs for those. And so this is something that all mobility managers, we gather this information either through focus groups or through surveys every year, just so that we can continue to understand the needs within our counties. Well, these are the needs within Lorain County. And they flip-flop between access to grocery stores and medical appointments. Drugstores, getting to banks, some of those kind of department stores, some of those kind of daily little things that people need access to is a strong need. And then visiting family and friends, that's that social aspect. And you can just imagine if you're living in any of the rural areas, you're really ending up being a prisoner in your own home without access to transportation. Now, one of the aspects that I didn't really think about until 2019 was that many of our seniors in Lorain County not only need access to medical appointments within Lorain County, but many of the specialists for the elderly or for the seniors are in Cleveland. And we don't have that direct connection, and so it's very, very expensive for people to go to Cleveland. I've been hearing that, it can cost upwards of $200 for somebody for a round trip to get to a doctor's office in Cleveland. So that's another need that we have here in our county. So next slide, please. So these are the challenges. That red line, squiggly line you see, is our transit system. And compare that to the size of our county. Whoops, back one slide, please. So in 2009, we had to reduce our 16 routes. We used to have 16 routes down to 4 routes. Those four routes are really 2 routes back to back. Our transit actually operates every 2 hours. So imagine that. If you miss one route, one bus, that's basically a half a day you're missing. Also, when you get on the bus, you must have exact change. Unfortunately, our bus is not connected to any technology, and there's no GTFS feed, which is the feed that Google uses and some other services use so that you can track a bus or even schedule times online. We don't have any of that right now. Prior to 2009, when we did have the 16 routes, we did have up to 800,000 rides each year, but once we reduced them down to 4, we're less than 10% of that ridership. So we're seeing about 70 to 80,000 rides right now. So these are the challenges that we are facing. So next slide. So now I'm going to talk about some of the pilot projects. This is one of my favorite parts of being a mobility manager, is having some ideas of what we can do to supplement the transit system that we do have in order to fulfill these gaps within the system. So even prior to me becoming a mobility manager, I started working at United Way under a grant program that we received called Circulation Health. And it was a technology company out of Boston that connected with Lyft drivers to get people to medical appointments. And so we worked with a behavioral and mental health organization to fulfill rides for people who were low income, who had no other means of getting to their appointments. And so when the caregivers or people making appointments at this behavioral mental health clinic would find that people didn't have the ride, they would make sure to book people. In the system, you could see when they were being picked up, you could tell when they were in the car, you could see how far away they were, you could see if they were late. We could track everything within the system. Those were the pros of using that type of system. The cons were that if we had bad weather like snow, there weren't that many Lyft drivers available. The further south we went into Lorain County or west, it was harder to find Lyft drivers. So many people who had appointments were either late or they couldn't make their appointment at all. Customer service was not always the best because sometimes the Lyft drivers, if they saw they were going to a behavioral or mental health location, some of them just canceled because they didn't want to go. Also, if somebody was in a wheelchair, most of the cars could not handle any kind of bulky, devices like that in their vehicle. So what we did was we were able to partner with our local ambulance service, and that proved to work out very well. They have a technology system that is able to track. We have improved customer service because they're used to dealing with all kinds of people, and they're ADA compatible. And this also helps to keep money flowing within our county, because many of the Lyft drivers that we were using were coming out of Cuyahoga County and going back. So this was keeping money also spent locally within our community. So next slide, please. Also during the pandemic, I became very concerned about some of the seniors who were not able to get out. And as a mobility manager, one of the aspects that we could use are 5310 vehicles that are within our counties. So I wanted to really test this theory because I knew there were a lot of nonprofit organizations that had these vehicles, and during the pandemic, they were sitting idle. And so I was thinking, hey, how can I start partnering with some of these organizations and making use of these vehicles? I was brand new, wanted to see how this worked. So I called up a drug and alcohol organization. They were willing to work with it. We had a funding source that we were able to tap into. I worked with our Office on Aging. They identified a building. I also contacted our county health department. We told them that we were looking to provide shopping during the senior shopping hours, which were first thing in the morning. We were going to make sure everybody was spaced, socially distanced on the bus, and only allowed 3 on the bus at a time on a 14 passenger. So we were able to use these idle vehicles. The seniors were able to get out. We scheduled via email with the apartment manager and then the person who was scheduling the buses of the nonprofits. The drivers loved it because they were generally doing a lot of cleaning, but they were now able to drive and help people who really needed it, and they were very appreciative. It was just a great service all the way around. Some things to think about. These are not necessarily cons, but things to think about. If I was not available or the apartment manager forgot to email, or the transit person who was organizing the bus service, sometimes that got a little clunky, or we forgot, the automating that part of the service would have been great. We had a funding source because we did not charge anything to the seniors for this service, but that funding source also ended up drying up and we had to stop it. Recently, I got a call from that apartment complex asking if we were going to start that back up. It's not something we were able to do. And our partner had to, they were doing telehealth services, which is why their vehicles were idle. They had to put those vehicles back into service. We could have adjusted the time because they were still willing to do it. But these are all just some little things to think about when partnering with a 53 vehicle organization like this. It's something that we could still do if we had everything in place. So next slide. So that small little project really led to this huge vaccination transportation project, which was a partnership with our local transit organization and also our health department. And also our 211 system. We were able to help about 160 people who probably would have not otherwise been vaccinated, get vaccinated because of this. The health department did not require any appointments. We were providing free transportation. So we tried to remove all barriers that we could in order to get as many people vaccinated as possible. The first thing I did was I worked with our local transit authority, identifying pharmacies that were along the routes that were giving vaccinations. We gave that to 211. So anybody calling in that was getting vaccinated but didn't have transportation could know the bus route number that they could get on and use to get vaccinated. I also partnered with our 5310 vehicle partners in different communities throughout the county to provide transportation. We had agreements with each of them, and we had all of the clients that were using the bus service. They signed a waiver when using the bus, just as a protection for all of us. Where we really focused most of our work for picking people up was our Metropolitan Housing Authority. That was the best fit because we had kind of an audience there to do loops. So Lorain County Transit, or one of our 5310 providers, would do loops to those housing authority locations to pick people up on a regular basis and bring them to the clinics that were happening throughout the county. Also, for people who weren't on those loops, who just didn't have transportation, once again, we partner with Life Care Ambulance, our local ambulance partner. to do one-offs to pick people up. We also used a Google Sheet to log appointments for anybody who didn't have transportation that wanted to get vaccinated, and all of the partners that were taking appointments, which was Office on Aging, El Centro, our Hispanic Community Center, 211, everybody who was taking appointments had access to this Google Sheet so they could log those appointments, and then our ambulance partner would take a look at that and get those scheduled. We tried to do some loops in some of the rural areas, especially low income areas, but it wasn't as successful because we didn't have the ear of somebody who had the ear of the people. So that was just a lesson learned for us. That's why the Metropolitan Housing Authority worked, because you had building managers that we could talk to who had the ear of people. The other lesson that we learned was about half of the people who booked the free rides through our ambulance service seemed to not take advantage of the transportation once it showed up to their house. Not trying to judge on that. It's just that, when the cost is $50 an hour for such a service, and you have this free service that shows up to your house and somebody doesn't cancel, that can get kind of expensive. So just want to make mention that that is something to be aware of, that I know that we are considering in the future not providing free transportation, but maybe having some mechanism for some type of cost so that there's some value. So at least maybe people think about canceling a service if they're not going to use it. So next slide, please. One of the things I forgot to mention, failed to mention on the other slide, was that I was at most of the clinics in person that the health department did, so that if anybody was stuck, I could call our life care ambulance right away to get them home, or if they wanted to come to that clinic and they found out at the last minute. So it was a lot of manual labor organizing a lot of these different transportation kind of programs. So now what we're looking to do is add the technology back in like we did at the beginning to make it easier. And so our focus right now is on workforce and filling open positions, and really focusing on low income and people with disabilities, filling those positions, and also reducing turnover. And we're working with a company called Share Mobility, which is out of Columbus, Ohio, in order to do that. And Share is going to be presenting during the 4th forum on October 28th. So you may want to tune in and listen more to learn more about them. They're very unique. You can either just use their technology and utilize idle vehicles like 5310 vehicles or other idle vehicles within your community, or they also provide their own vehicles as well for an additional cost. So they really can adapt to the needs within your community to provide whatever services that you may need. And the beautiful part about this is that there is money in the system in order to pay for this type of transportation. There's what's called a commuting pre-tax benefit, which is up to $270 can be set aside in a person's paycheck to pay for transportation services, similar to a health insurance benefit. And that could save somebody about $5,000 a year on transportation by making use of this, by them not driving their own car. So it would be an automatic pay increase by making use, by having somebody else drive them to work. So you may want to hear more about that on October 28th when they speak at that time. So next slide. So that is my presentation. I want to thank you for allowing me to present today, and this is my contact information. But next, we have Lisalecrone from Perry County.
Hello all, my name is Lisalecrone and I'm the Perry County Mobility Manager and also with the Region 8 Mobility Solutions Center. It's going to be hard for me to follow those two experts in our field. Tracy and Sharon do a terrific job in their areas. We're proud to be on a statewide team with all of those folks in mobility. In order to give you some understanding about Perry County, because we seem to be unique in every way, I wanted to give you just some understanding. First of all, we are a very rural county in southeastern Ohio, Appalachian Territory. We have a population of 36,000 citizens located in our county. All communities are villages, so we have no cities. We're not metro, not urban, don't fit into that. We are all villages out here in our territory, and it's in our territory region, the Region 8 Center. Most of our counties are similar and same. Several of our counties, 4 of our counties border the Ohio River to the southeastern side. So just to give you some understanding concept where we're located. Most medical employment for Perry County is located outside of our county, which means we don't have those resources necessary available within our communities. So people who are employed or needing medical specialty services are traveling to outer-lying Tier 1 counties, which would be anything that surrounds the border of Perry County, also into Tier 2, because we get into Franklin and Delaware and those counties that provide more specified medical services. So we do have public transportation in our county. We really take a lot of pride in our public transportation. We have been closely connected and worked with public transportation since 2014 in order to upgrade our services and be able to meet the needs of our communities and the folks in our county. Our public transit is a curb-to-curb services. And again, going back to that rural concept that I was telling you about, we pull up to their front door. Most of them, we don't have city routes. We don't have businesses and associations located close by each other. So we are still operating on a curb-to-curb, where we do pull up to in your driveway at your front curb and load you. We do become door to door if they're an ADA person and they request that service. We will not enter your home, but we will assist you from the door if you're wheelchair, walker, cane, or if you need help with delivering items, groceries, anything that you have, we would be able to attain to your needs. There are, as I'd stated, most of our runs are outside of the county, so that makes our transit system operating on very high miles and times. You have to take into consideration that road time when you're planning for those trips. So that's one of our things. The slide that's up now, what we want to do, that it's actually identifying, giving you a layout of our 8-county region. And then you see the state map there in the lower right side corner of the screen that gives you a concept or an understanding of the territories that we do cover and where we are trying to get people to. The part that I was to cover is, what does a mobility manager do? I try to keep things on a simplified approach. For one reason for that is when you're dealing with the elderly. We are all hopefully going to be elder someday. So the simpler that we can keep it, the better approach and understanding it is from our aspect of working with seniors and elderlies at this point in time. So we simply say, you have a ride issue, we have ride solutions. So that is derived from the one call, one click center that a lot of mobility managers are aware of or work with, or a concept that we are working towards. We, in our territory in the Region 8 Mobility Solutions Center, basically are on the one call. If that individual calls us, we're going to work every avenue on our end of it to resolve the issue of what they're experiencing in their particular situation. Not any and all of them are going to be the same situations. So it's sort of a challenge here. I do have 2 additional staff members that help us resolve transportation issues, but I will talk to that later on in the slides to let you know a more planned approach that we do. So a mobility manager identifies community resources that are available to provide transportation options for seniors, disabled. We want to ensure that they're getting to where they need to be. And that could be strictly for medical services. It could be prescriptions pickup. It can be grocery needs, which is very important to their nutrition. It can be bingo, card play, and recreation. It doesn't matter what the purpose of the travel is. The point is that we're able to get you there. So when we participate out of our office, we are highly involved with community partnerships. We work with various organizations, from the sheriff to the 911 to the senior centers, veterans offices, our SVP, retired seniors, DD board, our legions, American Legions, health departments, behavioral health sources. There's no end to what we can work for or with out of our office here. So obviously, when we mentioned COVID, that puts us all into a different role, and we changed or had to change up how we conducted business or be able to get the job done. So there's some items that I'll talk to you about here later on, and some ways that the face of mobility management really changed during COVID, and making sure that we comply with the restrictions that were set forth for us. So if you want to go to the next slide there, please. This is our mobility area. We're going to add each manager there as you see them slowly come up on your screen. There has been some staffing changes. Jessie Smitzer, which was the first one there that came up for Hocking, Athens County. Jessie was a great mobility manager. She is now working for the Ohio Department of Transit and the Transit Division, so I'm sure she will be doing great things there as well. And Megs will be putting on a new mobility manager because they have promoted Adam into their newly devised public transportation that will be going on coming January of 2022 for Meigs County. So there's some progression in our region as well. The next slide is mobility milestones, and there should be some little runners that come up on the road. There we go. The theory and the concept about Mobility Solution Center, where did it come from? How did we devise that? The Mobility Solution Center, going back to the one call, one click theory, how can we devise a number, a one point of contact for these folks to call in to get a ride to whatever purpose or wherever it need to be? So that's when we came up with, let's do a solution center. So we don't want to be identified as a call center. We're not just going to give you advice. We're not going to tell you the number to Marietta Public Transit. We're not going to tell you to contact. We want to provide more of a resolution solution to your situation. So when someone calls our office and they say they have a medical appointment, in the neighboring county and they need to go, we begin an assessment with those individuals. We do a customer profile sheet where we are going to be entering everything into a data system where if they're a repeated customer or they call us for another ride, that we have pre-displayed data available to us, such as their address, residential county. And some more items that we ask are, are you a senior? Are you a veteran? Are you disabled? Do you have Medicaid, Medicare? Those types of things, because what we're doing is we're going to start plugging these people into assistance, plug them into organizations that help provide rides or help with nutrition or help with SNAP benefits, heating fuel costs during the winter, a number of things that we'll start plugging them into. I see some of my runners are coming up there. They're supposed to be on the entire road there as it's loading now. So the theory about the Mobility Solution Center, how did we do it? It wasn't easy, but COVID helped that out because we had a lot of planning time on our hands while we were confined to the office, not being able to gather or attend meetings. So as you see there in August of 2019, we sort of thought we need to reach. There are so many citizens in these rural counties, in these areas that need to get to places for medical, for food, for nutrition. They're not being able to access it. So we came up with the concept, if we could devise the one number, we could have them call the 1-833 you go. We wanted something that would stick with seniors and they would be able to recall up on it or easily access that number. So we devised that, set that out. We did some additional planning and, who are you going to serve? How are you going to serve? Well, you got to have money to do that. So we applied for funding. And as you see there on the screen, it is not OPT2. It is actually OTP 2020, Ohio Transit Partnership Program. So that was a misprint there on our site for that But we applied for the funding under the OTP 2 programs, and we did receive approval from that program to be able to fund and establish and set up the call center, resolution mobility center, to be able to take care of that. We got the award like October of 2020. During that whole time, we were still planning on how do you do this? How do you reach these people? How do you serve them? So January 2021, the Region 8 collaboration was announced with mobility partners. So we stayed with our RTPO Region 8 area and just kept with the same 8 counties there. So in our 8 counties, we do have 5 mobility managers. Jesse and the new one will serve 2 counties. And then we have 2 counties that do not have a manager at this time. However, they are, under a survey, they're in the development of their coordinated plan. So those 2 counties will be coming along on a regional approach as well, with getting a mobility manager and maybe public transportation or improving their current transportation services. So with that being said, when we come into 2021, we had to get it off the ground. We're still under COVID, rates are high, the dreaded news that we get each week about your county, where the state stands and such. So we decided to do a soft opening in March of 2021, and that went well, and we started doing outreach. We started doing communication and contacts, senior apartments, elderly senior centers, places that, that we were trying to make some communication with them to let them know about us. We actually did do a full open house in June of 2021. And here we are today, operating and growing. We have a number of things that we do. I can't tell you that there's any one particular situation. The most call requests or ride requests that we have is for medical appointments or medical services. Sometimes that's real challenging because of, hospitals don't tell you till the night before what time to arrive. Well, that makes it hard to communicate that with public transit, who needs a drop-off time, who needs a pickup time, those specific things that are hard to do. That's where the mobility solution specialists here in our office works too. They work with schedulers at physicians' offices. They work with the nursing homes. They work with public transit to make sure that we make this seamless as possible. We don't want, someone having an issue where they're arriving late or outside their delivery time so that the process or the procedure can't be completed. So the next, after we have medical, most highly is medical appointments. Sometimes it's for court hearings. It can be for, rehabilitation services. We are entertaining multiple county parental visitations where, a child has to have supervised visitation with family members. So there isn't any one item that we experience out here in Perry County with the Solution Center. So if you'll go on to the next slide, I'll try to get back to there because I'm bouncing back and forth. There's our grand opening that occurred in June. When we were planning the path to success, we wanted to make sure, first of all, to identify everything. We wanted to have a vision. And along with that vision, we wanted to be able to have a resource database to support the operation at the contact center. So of course, you always have to have your partners. So what all partners is there in Region 8? There is numerous partners when you break them down to county by county. We had to establish the office. The toll-free number you're calling is in New Lexington. We are Perry County, part of the 8 region area. And we have created an ohiomaps.org website so that we're adding information as we speak of points of interest in the county, the public transportation, contacts, that type of stuff that's available on an 8-county basis. Our strategies, when we were considering all of these plans, we wanted to be able to connect residents to healthcare, education, employment, social connections, and recreation. So first of all, seeking ODOT approval and funding for that, and that went well for us. Engage partners. How do you get people to buy into what you're doing? I mean, this is just a thought that came from 3 of us in an administrative meeting stating we need to be able to reach people. So you have to engage partners in and get them to support what plans you have and where you want to go. Establish a mobility, again, the data resource bank for solutions to mobility needs. Regardless of what the need is, we try to be able to provide a resolution to that. Next slide, please. The path to success, well, we're still going. So our objective for the goals ahead was getting people where they need to be through coordination of mobility resources. And as I sit here today and I think back through the months that since March the 18th, when we actually went live with this, I can recall coordinated transfers from a gentleman who resides in Belpre down in Washington County. He resides on the Ohio River. He was needing to go to the Wexner Eye Institute in Columbus, Ohio. We got a couple denials of different transportation, so we kept working with it. And so Morgan County Public Transit and Perry County Public Transit, we coordinated a transfer. They brought the gentleman from the river partway, halfway. We picked him up halfway, we being Perry County Transit, took him on into Columbus to the Wexner Eye Institute, set the appointment early enough to where we could get the gentleman and his wife there, get them returned back home in the days and hours and services within public transportation. So it worked out well. They are repeaters. They return every 3 to 6 months and do the same services again because the gentleman has eye issues, and the family, it was just heartwarming for those, the gentleman and his wife, to be able to get him there, and she was so relieved that they were able to do it and be taken in under public transportation. So that was just some stories to tell you. They're numerous. There are numerous to be able to discuss and testify as to, you know, what can we get done on approach together. And that's where we come into, we coordinate across multiple counties. What can we do? You know, there is power in the numbers. And we have found that out with being able to coordinate services with all providers in our counties. So under mobility, the options for mobility, there's options walking and cycling. Yes, that is a form of mobility. And some people are able and fortunate enough to take part of walking, biking, cycling, electric bikes and scooters. Public transportations, which is a very large and very important segment of travel for Ohioans. Car sharing, we've got some of that going on, and we do, you know, suggest that, especially when there's one or more multiple people at an employment center, that we can sort of do car sharing and pair people up for that. And of course, driving alone, if you are able and to operate an automobile, you know, and if someone calls us and they have an automobile, but maybe no means for fuel, you know, can we do gas vouchers? Can we do, you know, fuel vouchers, authorizations, and that? So the objective is to improve health. Getting people to their medical appointments will improve their health and their way of life. It keeps them independent in their own homes, if possible. Education and employment opportunities. You expand the educational concept for, you know, graduates of high school, and employment opportunities for living independently and being able to be self-sufficient with your family and your unit. Mental health services, behavioral health, addiction services. There's no end to populations that we would like to serve, and we do serve currently. Next slide, please. This is our own mobility ladder to success. And of course, you've heard my other two mobility managers talk about the coordinated plan. And again, the coordinated plan is devised for your county. What works in our county may not work in another county that's not rural, or it may not work in another county that is rural. It's what your needs are. Bringing partners together, you with this coordinated plan, you have an inventory of your partners. You have an inventory of the resources within your county. This helps and assists the community. This is going back to being a community partner. If you expect to be a community partner, then be a community partner yourself, so that you are a voice in the crowd. Identifying the needs of county residents, those are your surveys. Last week, Brandy did a wonderful job in Washington County telling you about surveys and the purpose of the surveys for our coordinated plan. So that does come from the public in order to see what are your needs. Surveys tell you that. Next slide, please. There was one of our important partnerships, the ODOT partnership. Mobility in action. Some things that we worked on. Of course, we all worked heavily with our health departments because of COVID. We worked a special shuttle services because we had the OU Board of Nurses come and do a full day of drive-through shots. We had nowhere to park, 20 or more nurses. So we were able to get them into our community, bring them in, and provide a shuttle service, taking them to and from their cars. The EMA 911, that is one of two of the offices that we work very closely with. So if road closures, shutdowns, things of that nature occur, or if we need to move mass of people due to, a liquid spill of some sort and it's near an apartment complex, we need to evacuate, we're there to help along with that. It's slow loading. I thought there was another part to that, but that's okay. Oh, there you go. New Lexington School District Workforce Development. We also worked with children. They go to the farm where they work for their Future Farmers program. They're taught some courses of welding, farming, those types of things that would be able to prepare them for the workforce upon graduation. Vaccination clinics, we're still working with that. We've got a big one going on actually 13th tomorrow, the drive-through clinic within our county and communities, and we ensure that there are access for all individuals to be able to get to the vaccination clinics if they wish to participate there. We've participated with Community for Your Immunity, and that is if you wish to be vaccinated, that you would ride fare free to a vaccination shot clinic within our county, and that is in a coordination with our public transit. Next slide, please. This was created for the populations that we work with, elderly and disabled population. That is a large majority of our population. Slippery situations, we created this slide, of course, early in March. So we want to prevent them from any falls or anything. So we'll go the extra mile to make sure that they're assisted and taken care of properly. COVID ambulance service, that is on an increase. I don't know other counties, but in our particular area, we have really been working with the ambulance cot services to be able to make sure that those folks get to where they need to be as well. Community members in need, like I said, it's a very diverse need that an individual may have, and it may be something we have not heard of or worked with, but we will make every attempt to resolve that. Coordination of ride transfers with multiple counties on public transit. That is another big partnership, and I told you about that. Non-emergency medical transportation, I have to mention that because a large majority of residents or citizens in our area are covered on an Ohio Medicaid card. That gives them a zero cost fare-free ride to any medical service or pharmacy pickup. So that is a big thing for our area, and we work with a great number of calls on that each month. Next slide, please. This is our vehicle that we use to travel about in the region because we're not just sitting behind the desk. If we need to be to the senior centers, if we need to work county fairs, or we need to travel for whatever the purpose is, we do have our regional roundtables where we travel to each county so that we learn about each other's resources. We learn about what's available in each particular county so that we can better serve those citizens in those counties. Next slide, please.
Looks like that was the last slide.
Okay, that might be the conclusion of it. I was worried how I was going to fill 20-25 minutes, but there you go. That's the conclusion of my presentation. And from what I understand, we will take questions. Is that correct, Inga?
Yes. Yes. So I just want to thank all three of you because you guys did a really, really good job just explaining exactly what mobility management is, how people can actually resource. You get different resources and access, a mobility manager. And I think that this was a great topic as well because over the past year with COVID and everything else happening, we really saw an increase in people, needing assistance. And one of the things that we did hear about as Services for Independent Living was definitely transportation. And so I want to say probably about 4 months ago, which is probably kind of sad, I had actually just came in contact with a mobility manager and actually, found out what that was. So I am new myself as to hearing about, what a mobility manager does and how to actually access one. So I will look to see if we have any questions, but you ladies did a great job. Thank you so much. I love the visuals. And thank you everyone for dealing with all of the little technical difficulties that we were having today. You just never know with technology. So I'm looking in the chat box. We don't have anybody who has any questions thus far right now, but what I would do is in the follow-up email, I will make sure that I have each one of you ladies' information on how they can contact you. And so that way, if they have any additional questions that, they can do that directly with you. So I just want to remind everybody to be safe because we're still not out of this crazy COVID war in a sense. And I hope to see you all on for our next transportation forum series. I will be making sure I send out a reminder so that everyone knows how to register if you haven't already. So ladies, if you have any last words, you can go ahead. And if not, thank you so much.
Thank you, India.
Thank you. Oh, I went through